Hi, my name is Emily Bischoff, and I am a student practical nurse of the Northland Community and Technical College, and today I will be discussing congestive heart failure. Heart failure, this is a term that describes exactly what it is, the failure of the heart, and its ability to pump efficiently to the rest of the body. In this presentation, I'm going to discuss congestive heart failure, and I will be including the pathophysiology, risk factors, signs and symptoms, and differing treatment plans that can help a person live a better life with congestive heart failure. How congestive heart failure begins? It can happen on either side of the heart, literally being called left or right-sided heart failure. Both sides begin with the heart losing the ability to pump excess fluid throughout it, and the extra blood is left over in either the lungs or lower extremities. Most commonly, the left-sided heart failure is seen first, which then backs up from the vessels, making its way to the right side and into the lungs. Who is at risk? Getting congestive heart failure is not exactly pointed to a specific person, but to those with underlying conditions such as a history as being a smoker, having high blood pressure, being obese, having diabetes, and kidney failure. Many other related conditions can cause this. As a smoker, when smoking, the carbon monoxide in the inhaled smoke increases the pressure on the heart to work faster, and then the nutrients cannot get through the blood and to each part of the body. While quitting smoking will not take away the congestive heart failure, it will alleviate the amount the heart has to work and slows down the progression of the disease. High blood pressure is another risk factor that leads to congestive heart failure. It is known that the increase in the pressure increases the workload on the heart, and over time this will cause the muscle of the heart walls, especially the ventricles, to increase in size, therefore decreasing the amount of space in the heart. Another risk factor is obesity. The American College of Cardiology said that obesity is a paradox when it comes to heart failure, because obesity itself does not cause the actual diagnosis, but it is the prelude to all other risk factors that are contributed, such as the kidney disease, diabetes, and increased blood pressure. It is highly suggested that a patient should lose weight to help reduce these extra risk factors, although this may be hard for them because once they have the disease, it can make it hard to exercise. Signs of heart failure. The American Heart Association has listed many signs that a person may experience when they are diagnosed and have congestive heart failure. The most common signs can include shortness of breath, edema, or the swelling of extremities, and an increased heart rate. When fluid becomes too much for the heart, it must put it somewhere. This fluid can accumulate within mostly the lower extremities, as well as later stage it can begin to fill the lungs. Another sign is shortness of breath. Two reasons the patients experience this is because they are not exchanging enough oxygen within the lungs and because they are filling with fluid. Another is because these blocked parts of the lungs cannot exchange oxygen into the blood to pump to the rest of the body. The edema begins when the vessels of the lower extremities cannot keep up with the fluid and causes a noticeable swelling that, when becoming extreme, will be called pitting edema. The last sign that is included is that the heart rate will increase. The heart rate for a normal person is anywhere from 60 to 100 beats a minute, and this allows the heart to pump an efficient amount of nutrients, compensating for all of the body's needs. When a person has congestive heart failure, their ability to pump out enough blood diminishes, and that thus requires the heart to pump more times to catch up to do the required amount of pumping. Diagnosing and treating heart failure. Before anyone can be treated with anything, they need to be diagnosed. There are many tests that can be run to diagnose a person with congestive heart failure. The Mayo Clinic provides a few examples of these tests that a doctor may prescribe. An echocardiogram shows the size of the heart and how well your chambers are pumping blood to the next. A coronary angiogram is another test that they may prescribe. This is where a doctor will place a plastic catheter into your heart vessel and push a dye into your coronary arteries to show if they are blocked. A chest X-ray may also be ordered. This shows the doctor if there is any fluid buildup within your chest and especially your lungs. After a patient has been diagnosed with congestive heart failure, this is the time the doctor, most likely a cardiologist, will discuss how they would like to start treatment. There are many medication and lifestyle modifications that can be done to expand their life. Although congestive heart failure cannot be cured, it can be slowed and allow the patient a more comfortable life. Many medications can be prescribed to the patient. These medications include ACE inhibitors, beta blockers, and diuretics. The drug type the doctor is going to prescribe to the patient is going to depend on other factors such as how their kidneys function and how their liver is functioning. ACE inhibitors will lower the blood pressure and widen the vessels to allow more blood flow throughout the body. These are medications that end in pril, such as lisinopril, enalapril, and captopril. Beta blockers will slow down the heart rate, which lowers the blood pressure. The examples of beta blockers will include cardavilol, metoprolol, and these medications end in ol. Other medications class that can be helpful would be a diuretic. Most people would call these water pills. This medication will draw excess water from your extremities and lungs to your kidneys to be urinated, thus removing it from the body. When water is pulled from the body quickly, potassium may follow suit. The doctors will want to monitor lab levels for this reason indicated. Another major treatment measure that can be taken is a heart transplant. This does not happen with most cases, but if they are able, the waiting list for finding a heart donor is very long and may not be available for some due to their history, such as being a smoker or a drinker. Medications are not the only way to help with heart failure. Treating your modifiable risk factors can aid in living a more comfortable life. This can include changing to a heart-healthy diet, which is low in cholesterol and salt to decrease fluid retention. Stopping smoking will help your shortness of breath because the blood cells will be able to transport more healthy oxygen, red blood cells, throughout the body. Monitoring and losing weight will also help because the excess fat around the abdomen and heart is taking up space that the body needs to supply blood to. This will also allow for more space for the heart to pump more efficiently. What can the nurse do? The nurse has many priorities that they can do to help their patients. The nurse is going to be there for the patient after diagnosis, which is for most of those with CHF will have exacerbations, which will lead them to being admitted into the hospital. While they're there, it's most important to get their baseline normals because these things can change quickly. While knowing what their level of consciousness is and taking their vital signs will all help their treatment plan. All assessments that are taken will help them if they do become worse. A big thing that they can do is education. This takes priority because having a patient understand what they can do to alleviate their symptoms will help them lead a more comfortable life. You can include teaching them about changing their habits, such as what they eat, or if they are a smoker. The patient needs to know their medications as well, and so does the nurse. All of these will help the nurse and patient better understand how to make them more comfortable and living a longer life. When the heart is not pumping efficiently, and the many reasons for this, there are many changes you can take. Most risk factors are modifiable and if modified, can help with the comfort of the patient. Medications being given to those patients is one of the biggest treatment plans that doctors will go through with them. Your age cannot be changed, but a blood pressure can be. Taking your medications correctly and teaching the patients to know signs and symptoms of when they should call the doctor will help. Also, teaching the patient about signs and symptoms of heart failure can help them getting treatment faster, and then they will live a longer, healthier life. Education plays a big role between the patient and the nurse, and understanding the areas of congestive heart failure is key to giving them good education and prepare them for their treatment plan.